Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 homeopathic remedies for dengue. What is dengue? Dengue is a viral infectious disease which is spread chiefly by bite of Aedis Aegypti mosquito in human. Name of causative virus is dengue virus, DENV, DENV in English, which has 4 different serotypes, namely DENV1, DENV2, DENV3 and DENV4. As a result, a particular man can get affected with dengue 4 times. World Health Organization informed modern allopathic medicine has got no definite treatment of dengue. Quick diagnosis and proper general medical care may bring down the mortality rate to 1%. In some countries of Asia and Latin America, dengue has become a reason of serious illness and a pertinent cause of death. In cities, towns of tropical and subtropical areas of the earth, dengue reigns dominantly. Each year, though number of infection ranges between 10 crores to 40 crores all over the world, 80% of these cases are of mild type. It is said that once a subject gets cured of dengue, is immune to it for rest of his life. What are signs symptoms of dengue? Suffering from high fever, 40 degrees Celsius or 104 degrees Fahrenheit for 2 to 7 days with any 2 sign symptoms of the following means a dengue infection. Severe pain in muscles and joints of the body, inordinate headache, pain behind eyes, nausea and vomiting, swelling of glands, skin rash. Now, what is severe dengue? After 3 to 7 days of initial infection, a few cases of dengue attain a critical phase leading to even death. Following sign symptoms are noted in this phase: severe pain in abdomen, fast and labored respiration, vomiting over and over, gum bleeding or nose bleeding, pervading weariness, restlessness, liver enlargement, blood vomiting or blood in stool. This is a picture containing dengue symptoms. I've got it collected from internet and placed for your noting. Why is dengue called bone break disease? In initial phase of dengue, a severe intolerable pain is felt in the bony joints of the body. Thus, it is often called bone break disease. How is dengue confirmed by lab technique? By testing the presence of virus created protein NS1 in blood, dengue is confirmed easily. This demands 20 minutes of time and no special lab instrument or rigorous process. That is, by simple testing with the help of chemicals and a test tube, it is enough to prove that dengue is present in the blood. On the right hand side, two pictures as given. One is a person who is ill, is lying within mosquito net. Who are predisposed to dengue? Those who reside in tropical or subtropical areas, those who suffer from dengue once, that is, who has already suffered from dengue once, they are predisposed very much. Those who reside in cities and towns, those who have poor ideas about water preservation, water and solid residue disposal, those who do not use mosquito nets or do not take preventive measures against mosquito bites. tropical and subtropical areas have been shown in this picture. This blue, deep blue and light green areas are called tropical zones. Is vaccine for dengue available in India or Bangladesh? Vaccine Denvaxia CYD-TDV, invented in 2015, is probably in Greece, is available in world market. However, this is not used in India, neither in Bangladesh. Indian Council of Medical Research, together with a few big drug manufacturing companies in private sector, is said to have achieved a considerable progress in producing indigenous vaccine for dengue. It is hope, actually we hope that it will be coming to Indian market as well as Bangladesh market very soon. How to prevent and control dengue? General measures. If you are a victim of dengue, please assure that no mosquito can bite you in the first week of infection. This would arrest spread of dengue. Drink water adequately, about 3 liters a day. Take fresh fruit such as pomegranate, oranges, mosumbi, apples every day. Success of control of dengue is much dependent upon arresting breeding of its vector, that is mosquito. Controlling environment, we should ensure that mosquitoes face no entry to its breeding ground. Disposal of solid waste properly. Preservation of accumulated water by placing lids on container, draining off or cleaning the stored water at least once a week. Use of proper pesticide on outdoor water tank and drain path of water. Arrange to keep safe from mosquito bites in each household by wearing dresses, leaving least bare skin area, using nets in windows, doors, mosquito repellents and mosquito nets. Some relevant pictures are given for your noting just. How to control a physician. Now, when to consult a physician in dengue in Bangla? After 24 hours of remission of fever, if victims do not feel at home or relieved, they should contact doctors immediately. Having traveled through a dengue-stricken area, if one feels sudden high rise of body temperature and any two of the other signs and symptoms of dengue, one must consult a physician. While suffering from dengue, if a subject suddenly starts vomiting up blood and again and passes blood as stool repeatedly, he must consult a doctor immediately in case of any other emergency situation. What is the homeopathic preventive remedy or homeopathic vaccine? Previously I told that no vaccine is available, but this vaccine is always available from the time of invention of homeopathy. Homeopathy doesn't change. I mean, once a medicine is fixed for a particular disease, that will remain fixed so long the total symptom of the particular disease remains constant. So this is homeopathic vaccine for dengue. Though there is no at present modern medicine vaccine. Get Eupatorium parfoliatum. This is the name of the medicine. This image is given. Eupatorium parfoliatum. 200 4 to 5 globules for 3 consecutive days in empty stomach. Repeat after 9 days from first day of getting the remedy. Since the duration of action 7 days, the medicine just remains its action for 7 days only. So from last day 7 days, so after 9 days from first. Get the remedy in this way so long the disease prevails in your area. Please remember, this is additional information. The signs and symptoms of this remedy have similarities with that of malaria and flu. That is, malaria and flu generally have the same symptom as that of Eupatorium parfoliatum, as we see in dengue. Dengue actually sort of flu actually have similarities with that of malaria flu. So when these two diseases take shape in the epidemic, if malaria flu appear as epidemic in a particular area, Eupatorium parfoliatum may be taken as above for the prevention of malaria and flu. That is, in that situation, the vaccine for malaria and flu will be Eupatorium parfoliatum. Please remember this. Now, remedies during active disease. Aconite for dengue. Dengue of violent form, sudden attack, head hot, limb cold, pulse fast, feeble, subjects in coma or fully exhausted, burning before, during and after urination, squeezing pain in waist and kidney area, fear of death, anxiety. Burning for dengue, profuse saliva, moist, swollen tongue, unquenchable thirst, dysentery or diarrhea with severe tenesmus, pricked dust sedimentation beneath urine, pain in scrotum. Troubles increase at night, all discharges from body, sweat, urine, stool, saliva, putrid, whole body trembles with a little exertion. Subjects weep while grown angry or offended, reluctant to talk or perform duty, averse to meat, coffee and butter, crave wine and sweets. Arsenicum for dengue. Subjects anxious, fearful, even suffer from fear of death, mental and physical restlessness, crave hot drinks and dyspnea during chill phase, hot as of hot water in veins, hectic fever. Hectic fever means where the fever temperature ranges between high and low is a very significant one. Sweat with great thirst, cold sweat, used to drink a sip of water again and again. Rastox for dengue. Subjects very restless, joints stiff, hard in fast movement, then they become gradually normal while continuous in motion. During rest, old problems of joint return. Easily chilled from least uncovering, with pain in limbs, chill preceded by cough, alternating with heat. Want to yawn and stretch during chill. Delirium in heat phase, rash during fever. Actually, all intermittent type of disease has got 3 or 4 phases. Number 1 is the still stage, then come heat stage, then sweat, lastly the fever is relieved. Delirium in heat phase, rash during fever. Tongue red, dry, cracked with triangular tip, with coppery and bitter taste in mouth. Cantharish for dengue. Subject pass blood urine. During passing, pain like cutting or burning. Pains like cutting or burning. Pain as if whole intestine burning, with severe thirst, but a little drink excites urge to pass urine. Averse to all types of foods and drinks. From air tubes, string like mucus comes out. Severe sexual urge in subject. Note the peculiar symptom. The patient is suffering from a severe disease, yet his sexual urge is there. This symptom is called USP, uncommon, strange, peculiar symptom. If you find this symptom, then directly you give cantharish. You need not check other symptoms. This symptom is so important. Sickle cord for dengue. Fully exhausted with dengue. Expiration ice cold. Face hypocritic. This type of face is called hypocritic face. Skin, limbs very cold, yet avoid covering. Craves fresh air, lemonade and acid water. Burning all over body as if sparks of fire falling. Cannot tolerate heat, crave cold. Mercurius for dengue. Breathing labored, face cyanosed, drowsy with twitching of muscles. No relief from sweat, which is oily, foul, sour, with penetrating sweetish odor. Seen on head, chest, staining linen, indelibly yellow. That is, all these things are characteristic of the sweat. It is oily, foul, sour, it is penetrating, there's only penetrating sweetish odor. It is seen on head, chest, and it stains linen yellow very much deeply, so that it is indelible. It cannot be effaced easily. Dry, painful cough with troubles of lungs, vomiting of viscid mucus, air tube blocked, lungs seem paralyzed. Troubles increase in evening, at night from heat of bed. Subjects anxious, fearful. Tongue moist, swollen, putrid, profuse salivation. Halitosis. Halitosis means bad breath. Want to drink a lot of water. Podophyllum for dengue. Passive hemorrhage from various orifices of body. Urine thick, scanty, limbs cold, fever at 7 a.m. with pain in knees, ankles and wrists. Subjects delirious in fever, tongue moist, flabby, indented. Indented means that, the impression of teeth by the side of the tongue, that is indentation. Coated as of mustard sprayed on it. Loss of taste, profuse saliva, thirst for large quantity of cold water. With this, the video ends. Thanks for listening and viewing. If you got any problem, please write down in the comment section. I will certainly respond.